My name is Dr. Kelly Aldrich. I am an informatics nurse specialist. I'm the Chief Clinical Transformation Officer for the Center for Medical Interoperability. I have 35 years of healthcare experience being a registered nurse. So the Center for Medical Interoperability is a nonprofit made up from healthcare systems. The CEOs of the health systems sit on the board and equally own the nonprofit research and development arm. So we exist in order to allow for the use of standards, two-way plug and play medical device at the episode of care connectivity in a highly reliable factor. So that is the target vision for the center. What I would do around mobility is I would always hear how our clinicians did not want to be tethered to a workstation, but they asked to be mobile knowledge workers. The issue with that is the reliability of the infrastructure, where they would drop calls and not be able to stay connected when they were speaking to a physician or another clinician. In emergency times, they are trying to reach critical people that were making decisions and couldn't get connectivity. So what I did in my prior role in informatics was I asked the clinicians, what would make your life easier? What would reduce your burden and help you in your day-to-day practice? And the top 3 requests were clean up the EHR, make me mobile, and give me a smart environment to work in. So this came from 600 nurses from the bedside, and those were fed into me to create a roadmap around, of course, mobility. So I have a lot of experience in looking for what are the requirements that would meet the needs of the clinicians, as well as what's the scaling opportunity of the infrastructure that is necessary to be in place to make that a successful tool for the clinicians to use. Oftentimes people look at technology as the ultimate go-to, that they, of course, are going to solve all clinicians' problems. And that, in fact, is not true. These are tools that help facilitate the clinician to get back to the bedside to take care of patients. And that is the most important part. When we talk about rolling out barcode medication administration, we have nurses who know exactly where in the room they can scan the patient's wristband or where they have to move the patient in the room to get connectivity. So if we're trying to create a safe patient environment by investing monies in barcode medication administration, we have not made the investment in the infrastructure to make it reliable or useful for the care team to actually use this, as, again, as a reliable tool. So we're holding them accountable for the lack of scan rates, which truly can cause patient harm. But if we don't have a reliable infrastructure for them to stay connected to, it doesn't seem to add up to hold the bedside care team accountable for the lack of infrastructure for the mobility solutions. The biggest obstacle and challenge that the facilities currently face is the fact that the tools are not necessarily in alignment with the current infrastructure. So if you think about networks and traffic, this is very challenging when you have guest access interfering with clinical device. Yeah, so that's a real problem. When you have people, so for example, if you have a pediatric hospital and the kids want to be watching videos or movies, you want them to be able to be distracted and use those sort of kind of games and so forth. You want the visitors to have a positive experience. The problem is that it interferes with the network, and then the reliability for the clinicians to be on the same network is a real problem. So this is a barrier that the infrastructure of mobility was not necessarily put in like the electrical system was. So the electrical system has standards. We don't have that same thing for the mobility infrastructure. And so if we decide to do a new wing of a hospital that has the latest technology that gets put in for access points, but not have I seen a thoughtful approach to an architectural design. And that is mostly going to be creating the highly reliable system that we as clinicians need to be able to communicate with one another and also to serve our patients.